Following its previous federal health IT strategic plan, the Health and Human Services Department looks to continue the effort with its latest one that covers the next 6 years, open for public comment now. Officials are hoping to continue improving the exchange and availability of electronic health information. They also have some new goals in mind. I got the chance to speak to one of those officials. Dustin Charles is policy specialist in the Office of the National Coordinator for Health Information Technology, and he joins me now. Dustin, thanks so much for joining us.
Yeah, thanks for inviting me.
Absolutely. So why don't we just take the 40,000-foot view and hear a little bit about what this new update to the Federal Health IT Strategic Plan is and what it hopes to accomplish.
Our federal health IT mission is to improve the health and well-being of individuals and communities using technology and health information that is accessible when and where it matters most. We additionally have the health IT vision of a health system that uses health information to engage individuals, to lower health costs, to deliver high-quality care, and improve individual and population health. So when we were planning this version of the strategic plan, we really wanted to focus on improving the experience and outcomes for those who use and are impacted by health IT. So if you look at the plan, you'll see what we've done with the goals is delineate them by the different types of health IT users. So goal 1 focuses on individuals, populations, and communities. Goals 2, those involved in healthcare delivery, including patients, providers, caregivers, public health professionals, and others in the healthcare sector. Goal 3 is focused on research and development of health IT. And finally, goal 4 addresses that infrastructure needed to achieve the other goals.
When you say health infrastructure, the health IT infrastructure, that seems to be always the biggest bugaboo, right? I mean, it's because a lot of these places, the hospitals and medical offices weren't set up for this kind of exchange of information and to be constantly updating their technology. What does it specifically say in this new plan to address that?
As we've done these plans, so the earlier plans were really focused on adoption of the technology, particularly getting providers to adopt electronic health record systems. And then, for example, the next plan was really more about that exchange. And the current plan that we're in is really more about addressing barriers to exchange and ensuring that there is that access and use to health information. So with this plan, we are focusing it a little bit more broadly outward. We have made major headways in exchange, but there are still some obstacles in the way, and there are still some new emerging technologies we want to make sure are addressed in this plan as we move forward in the next 6 years. So it's really taking the progress that we've done and then looking at, okay, where are some of the remaining gaps and what are the new things that need to be addressed?
Yeah, can we go back to the previous plan? What was some of the progress that you all saw in the implementation of that one? And, tout yourself. Which ones are you guys most proud of?
Some of the stuff we're most proud of is some of the advancements in exchange. We have what we call the TEFCA, the National Exchange Framework is definitely one of them. The other side of the exchange is the FHIR standards, sort of the HL7 FHIR standards that allow providers to have a shared way of communicating electronic health information with one another. We're also happy to see that a lot of hospitals are, particularly APIs, so not just FHIR APIs, but they have some of their own homegrown APIs and others that they're using as well. So we've seen significant progress throughout the whole health IT in using a lot of the technology that has been developed, and particularly those promoted through the federal government.
We're speaking with Dustin Charles. He's a policy specialist at the Office of the National Coordinator for Health Information Technology, part of the Department of Health and Human Services. And so let's go back into the plan itself. You guys coordinated with a plethora of other partners in this activity. Can you tell me a little bit about the roles that some of the other agencies played in the formulation of this new policy?
One of the things to note, this is a federal health IT strategic plan, so it doesn't just cover the strategies for the Department of Health and Human Services, which is what my office is under, but the entire federal government. So we might, within the plan, cite some federal programs and projects as examples, but we don't prescribe any specific programs for federal agencies to engage in. Rather, the plan itself serves as a roadmap for federal agencies to help them prioritize their resources, coordinate efforts across agencies, signal priorities to the private sector, as well as benchmark and assess any changes over time. So we wrote the plan broadly to capture the overall priorities and goals of the federal government in regards to health IT. So some of the things that federal agencies do in health IT, beyond just the work that ONC does, is regulate, purchase, develop, and use health IT to deliver care, improve patient health, and provide services to the public. They fund and contribute to health IT development and research at all the different levels of the government. And we also facilitate coordination across public and private sectors. We want to align our standards that we're promoting with the work that's being done in the private sector. We want to promote innovation and competition, and we want to share best practices. So because of this, when we get to the final plan, it will be that roadmap that will guide federal agencies, initiatives, and programs over the next 6 years.
Gotcha. And this plan is now out for public comment. I'm just curious, who are some of the stakeholders that you all expect to hear from in regards to how the plan will actually be implemented?
Well, we really hope to hear from as many different people within the healthcare industry as we can, anyone who has an interest in health IT and the role of the federal government. We do expect to hear from health IT developers. We expect to hear from, hopefully, healthcare organizations, as well as we would love to hear from patients and healthcare providers themselves and kind of get what their insights are, what stuff they would like to see in health IT. We are in public comment until May 28th. So you can access our public comments at healthit.gov/feedback and up until May 28th. And we really look forward to getting those comments. We will share them with our colleagues in other federal agencies and coordinate them to develop the plan.
I'll give you my comment now. Can you make it so that I don't have to fill out the same form 7 times every time I visit the office, or is that out of your purview?
I think that's something that we'll add it to the list.
Fantastic. All right. Well, I've submitted my public comment now. Dustin Charles is a policy specialist with the Office of the National Coordinator for Health Information Technology. Dustin, thank you so much for joining me.
Thank you.
And we'll post this information along with a link that Dustin mentioned to make a public comment at federalnewsnetwork.com/Federal Drive. You can also subscribe electronically to the Federal Drive wherever you get your podcasts.